Hey there, and welcome to this explainer. If you're tuning in, chances are you or maybe someone you care a whole lot about just got handed a diagnosis of Polycystic Ovary Syndrome, or PCOS. I know, hearing those letters from a doctor can feel completely overwhelming, right? Especially when you're young. But listen, today we are going to demystify this whole thing together. We'll translate all that dense medical science into plain English and build a really empowering personal daily toolkit to help you feel absolutely your best. So let's dive right in. Look, trying to Google PCOS on your own, it's basically a one-way ticket down a really scary rabbit hole of overwhelming information. But what does this diagnosis actually mean for your body and, honestly, your everyday life? Take a deep breath. We're going to break this down step by step. Here's our roadmap for the explainer today. First, we'll talk about why you are not alone. Then look at what exactly PCOS is and decode those tricky medical terms. After that, we'll cover diet and hormone balance, set up your daily lifestyle toolkit, and finally, talk about caring for your mind. All right, jumping into section 1, you are not alone in this global community. Get this, the World Health Organization estimates that over 116 million women worldwide share this exact same condition. Just think about that number for a second. 116 million, that is literally enough to fill thousands of stadiums. So you are absolutely 100% not alone in this. There's a massive, super supportive global community out there with a wealth of shared experience ready to have your back. Moving on to section 2, what exactly is PCOS and what physical changes are happening? Now, doctors use these incredibly complex flowcharts and clinical guidelines to diagnose PCOS. I mean, it looks super intimidating on paper, doesn't it? But for you, getting a diagnosis really just boils down to a few core signs that your doctor is actually looking for. Under the most common guidelines, doctors are essentially looking for a mix of 3 key traits, and you generally just need 2 of them to get a diagnosis. Those are irregular or skipped periods, a hormonal imbalance with excess androgens, and sometimes the appearance of small, totally harmless follicles on your ovaries during an ultrasound. Let's head into section 3, decoding medical terms into plain language. Okay, first up is hyperandrogenism. I know, it's a giant, scary-sounding word, but it simply means your ovaries are releasing a little extra of what are often called male-type hormones. And hey, all women naturally have these, but when these hormones are slightly elevated, they act like a trigger for those frustrating outward symptoms you might be dealing with, like acne breakouts, unwanted body hair, or even thinning hair on your scalp. Next is insulin resistance. Basically, this means your body has to work overtime to process the sugar in your blood. Because your cells aren't responding easily, your body just pumps out extra insulin to compensate. And here's the kicker. That extra insulin actually signals your ovaries to make even more of those androgen hormones we just talked about. It's kind of this tricky, frustrating little cycle. Finally, you might hear your doctor toss around terms like oligomenorrhea or anovulation. Because of those hormonal shifts and the elevated androgens, your body's normal ovulation process essentially hits the pause button. It holds off on releasing an egg, which is the exact reason why your menstrual cycles might become unpredictable or why you might skip months at a time. Okay, section 4, diet and hormone balance and how we can naturally manage it. Now for some incredibly empowering news. You can actually start managing these hormones naturally, right on your plate. Choosing low glycemic foods over high sugar ones stops those sharp blood sugar spikes in their tracks. Stabilizing your insulin this way is literally like turning down the volume dial on your symptoms. It directly lowers your testosterone and reduces inflammation across the board. And the best part, this doesn't have to be some complicated, hyper-restrictive diet. Simple, everyday swaps make a massive difference here. Try tossing more fiber-rich greens and healthy fats, things like avocado or salmon, into your meals. These naturally feed your healthy gut bacteria, they keep you full, and they totally soothe your metabolism without ever making you feel deprived. Let's roll right into section 5, your daily lifestyle toolkit and some actionable steps. To really help you feel in the driver's seat, we put together a simple morning checklist to start your day off right. First, eat a blood sugar-friendly breakfast to set your insulin up for success. Second, get in some gentle morning movement. And third, take just 1 quick minute to log your cycle and how your body is feeling. Seriously, tracking is like your secret weapon for understanding your body's unique patterns. And hey, when it comes to movement, you do not need to go run a marathon. Whether it's taking a brisk walk while listening to your favorite playlist, doing some light resistance training, or just a really fun dance workout in your living room, regular physical activity is basically natural medicine for PCOS. It makes your cells way more sensitive to insulin, and honestly, it's just a fantastic way to burn off that daily stress. Finally, Section 6, caring for your mind and your emotional well-being. Because managing a chronic diagnosis isn't just a physical thing. Even the official medical literature openly acknowledges that these symptoms can be deeply, deeply distressing. So if you're dealing with anxiety, frustration, or maybe some low self-esteem right now, please note your feelings are entirely valid and real. Your mental health deserves exactly as much attention as your physical health does. Always remember, adopting these new lifestyle changes is never, ever about punishing yourself with super strict rules or trying to fit some specific aesthetic. True wellness is all about creating a supportive, nurturing environment so your amazing body can heal. Just take it one gentle step at a time, and please give yourself a whole lot of grace along the way. You've now got the knowledge, we've decoded that scary medical jargon, and you have a realistic daily toolkit to start feeling better today. So the big question I'll leave you with is this. What is the very first, small, empowering habit you are going to choose to start tomorrow morning?